We're going to talk sports medicine right now for a guy who can dive into the situation, and that's my good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hey, Ray. I'm sitting here scratching my head with you. I saw a fair bit of those first two outings and felt so good and optimistic about the fact that it looked like Shane Bieber was back. And 20 strikeouts, shutout ball in his first two outings. And, wow, the UCL is really tough. The ulnar collateral ligament, and a lot of people want to talk about this. I've gotten a lot of media requests this week. I don't know. It seems like the ruination of young pitchers' arms all of a sudden has caught the imagination of a lot of people trying to figure it out like you and I are. And remember, it's not a baseball thing overall. Other positions don't get this. If they do injure, it's usually somewhat traumatic and other things, and often they can rehabilitate and get back. But it's strictly pitching. You can't generate the same velocity that you need to do to be a good pitcher if you tear that ligament in the inside of the elbow, known as the ulnar collateral ligament. Even in other sports, people can play and rehabilitate through a UCL, but not being a good pitcher. And in the weekend, I didn't realize because I pay so much attention to our teams here, is there were two other people within a 24-hour period that were Cy Young level, some of the best pitchers in the league, three pitchers in a 24-hour span, young pitchers that tore their UCL and are going to need surgery and be out for over a year. So this has been going on forever. One of the athletic trainers who works strictly with major league pitchers, I read several of his articles. He actually tends to call it not an epidemic anymore; it's a pandemic in young pitchers, and there doesn't seem to be an end in sight. There's been a 400% increase from 2011 to 2021 rate, 400% increase, and 37% of all major league pitchers will tear their UCL. Greater than a third will tear their UCL and require surgery. Another disturbing trend is in the last 4 years, there's been a doubling in the number of people that have needed a second surgery after they had the original surgery done. So all these things are really, really concerning. This trainer that I read a fair bit about, Stan Conti, has been a baseball pitcher, trainer in the pros for 23 years with the Giants, the Dodgers, the Marlins, and read some of his stuff. There's 4 theories out there, Ray, and everybody's calling for research to get to the bottom of this right away before there's a ruination of baseball with the best young pitchers. But the point is, you and I know, and we talk about it in research, research is not going to be overnight. This is going to take a while to get to the bottom of it. Number one, for a long time, people have said the quest for increased velocity. That's really changed in the last 5 to 10 years. And this is how young pitchers know that they climb the ladder to get to college, minor league, major league, is when they start getting their velocity on the radar gun up. It catches people's attention, and so everybody's going for every last bit of velocity that you can, and the quest for velocity is a big reason why. Number 2 was new to me. I had to read about it a bit more, Ray, and I wanted to tell your audience that it's such a you have so many really good sport fans that know. It's called the spin rate, and the spin rate is the and I know that I've noticed this when you're watching baseball, but the way the ball kind of breaks and snaps off even on fastballs and breaking pitches, they say for an average major leaguer, there are 2,200 revolutions per minute in a pitch that people have. And that's that snap, that breaking the pitch. And one of the things that changed in baseball is not letting people hit the ball to your fielders anymore, is everybody wants strikeouts, and the strikeouts have been the key, getting the Ks up there, getting the strikeouts. And the way you can affect spin rate is the grip, the arm angle, the release point. These are all ways that people are looking for that strikeout pitch with the spin rate. And I'm concerned. I think spin rate makes a lot of sense as to one of the reasons why this has risen so much. Number 3 was something that came out earlier in the week was a lot of discussion of the pitch clock, Ray. I know you heard that. There was an MLB protest earlier in the week that, hey, there's more injuries. Let's immediately start studying this. But it's hard to study something in the middle of the season with the pitch clock. And one thing that kind of hurts that argument is that in the 2 years that we've had the pitch clock, there's actually been a decrease in the number of UCLs. There were more in the 2 years leading up to the pitch clock. The thought is that there's not enough time between pitches for any opportunity for those soft tissues, the ligaments and tendons around the elbow to be able to bounce back and get any rest at all with the pitch clock. And then number 4 is the wear and tear argument. From pitching at a young age, 12 months a year, pitching with more than one team, pitch counts that get up too high for these young pitchers, starting at, and we know this, 14, 15, 16 years of age when you get a good young pitcher, that people want to start working with them year-round, throwing off the mound, throwing as hard as they can, maximum effort throws at a young age. And that age of tearing the UCL has gone down in my 35-year career. I've seen it. And this is maybe one of my biggest frustrations is we have not been able to change the behavior pattern with pitchers. We've done it to some extent, some success with concussions. We've done it with some success in the weight room. We've done it with some success in the overuse world of gymnastics and dance and others, but we just can't seem to do it with young pitchers. And Conti talks about it's like the tread on a tire, and you start losing that tread on the tire till the tire goes bald. And many of these people, by the time they get to the higher levels, they already have so much wear and tear. They're a setup to be in that 37% of major league pitchers who tear their UCL and need surgery.
Joe, I think you hit on those things, and they're all spot on. And you know, you and I have talked baseball for over 25 years together, and I've been around baseball most of my life. A couple of factors that I really think you're right on top of, and that is the overuse. And I coached in travel baseball, so I see these kids and some of these coaches and organizations wanting to pitch almost 12 months a year. But I've also seen, and you didn't touch on this one, and I wanted your perspective on this because you go back to the 40s, 50s, 60s, and 70s. We call them drag pitchers, right? The motion was hands above the head, and you would use that leg strength. You would push off the rubber. You would stride down with your legs. And the key to being a good pitcher, ask Nolan Ryan, Tom Seaver, Jim Palmer, Bob Feller, was that stride and push with the legs and the abdominal area. And when you look at the motion in today's pitcher, it is standing on the rubber, stepping back with a ball at your hip, and then firing with all what? Shoulder and arm. And I think that's a big problem here with pitchers, is it's all arm and not so much the drag pitching motion that we used to have for so many years.
You know, every single one of those pitchers you just mentioned came to my mind as you thought of Nolan Ryan and Tom Seaver and those guys. But they did it through sheer power and velocity. And nowadays, to get the Ks, to get the strikeouts, it really became somewhere in the last 5 or 10 years is the ability to make the ball move, the movement of the ball, the spin rate. I think that really resonated with me when I read a few articles about spin rate. I think that might be one of the real major issues here is, you know, when you're watching a game at night, you see the way the ball breaks nowadays, and exactly it's all about now more arm angle that we talked about, and grip and issues like that, release points, rather than the power coming from below the waist. And so I've been a lower half person for so many things that's strong in sport. Just watching the NCAA tournament, it wasn't all about upper body strength in a lot of those people. It was how strong their lower body was. And I agree with you on the pitcher, and I think we're onto something with spin rate, but I don't know what we're going to do about it because strikeouts are what what makes these pitchers great and what makes people making money. And I think everybody is out there trying to get the ball to move as much as they possibly can, Ray. And I think that is a mindset that's going to be hard to turn around. We've done it in other sports, but I'm very frustrated that we've had difficulty doing it in the sport of baseball pitchers.
Well,
one other thing, Ray, is the difference people don't realize between the UCL and the ACL. With ACLs, we can tell right away with a lot of those lower extremity by the way it happens, the mechanism, the swelling, the exam. A lot of these UCL kids, you can't tell if it's just a strain for a while. Many of them are in our office. You can't do an MRI on every single elbow that comes in the office that has throwing pain. And so it's also very hard to diagnose. A lot of these kids go back out and pitch with these partial tears, and then the next thing you know, in 3 to 6 months, they're in with a complete tear of the UCL.
Joe, let me ask you this. With the UCL tears that is, and you and I talked about comparable stats, going back 10, 15 years ago, how many of those type of surgeries did you do on the youth compared to now in, say, 2020 to 2024?
Oh, my gosh, significantly less. So that number blew me away when I saw Conti talking about 400% increase in 10 years. But in young kids, it's even more than that. I used to just tell the residents and other people, you're just not going to see this in 12, 13, 14-year-olds. And in the last month or two, I've had several 13, 14-year-olds in our office that have had UCL. So it's been a significant increase. I think it follows right behind that 400% increase, Ray. And, of course, that's very concerning to me. So all of who might have wound up to be our best pitchers, had they made it all the way through this, they're tearing their UCL. Not only that, many are needing a second surgery, and they never get to college. They never get to the minor leagues. Many of some of the best pitchers that we would probably have seen never make it because of the fact that they get injured before they get to the chance to really show their talent.
Joe, what did we say years ago? Chicks dig the long ball and money follows the strikeouts. And I think that's what you were getting at a couple of minutes ago. It's pitching now is all about getting the Ks instead of getting the outs. And I think you're really onto it with the arm motion and the spin rate for sure. Just a great interview, Joe. And thanks for the insight and the education into this. More to come. Look forward to talking more about this, the unfortunate loss of Shane Bieber with another surgery just ahead for him. Thanks for the time again, Joe.
Thanks, Ray. Have a great week, okay?
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.